finished our last day of sim.
Hello, my name is Lonnie, and I am currently a D2 student at Midwestern University in Arizona. And I want to take you in a eventful week in my life, eventful as in school eventful. This is our last official week of sim because next week we are doing our final test in sim. Let me give you a rundown of what's been going on. This is the end of D2. Right now it's week 8, so we have 3 weeks of school left and then finals, and then we have a week off, and then we start our D3 year where we're in clinic, which is crazy. It's very soon. We've been doing a bunch of testing, trying to learn everything so that we're ready for clinic. Last week we had, I personally think, our hardest test was exit interviews or critical thinking interviews, where we have an interview with 2 faculty and they ask us questions and you had to get at least 3 out of 5 right, but it's like not just simple questions. We basically had to study everything that we've learned, all the protocols, how to do a root canal, and we could not bring any notes or anything. We had to do the protocol about implants, items to use for different procedures. So it was a lot to study for. I've honestly been studying since the beginning of this quarter, which was like for 6-7 weeks. And that was very nerve-wracking because interviews are already scary enough, but then having an interview where there are definitely like right or wrong answers is so scary. But that was last week. I had some decently hard questions. Some people had pretty easy questions. Mine were just decently hard. For example, a lot of what we study is like how diabetes or how smoking like affects your patients and their health. My patient had a mitral valve prolapse without regurgitation, and that is not as much something we focus on, so I was very thrown off by that. But I passed, thank goodness. We found out like the day after and everyone was on edge, but we got through it. I studied a lot for it and I felt very relaxed after getting that over with. What we have coming up, so we have an OSCE this week on Friday. It's where you have like a minute per station to answer a question. So each station will be a question and you have 1 minute to answer it, and then you move to the next station. And I have to study for that. It's similar to where we have to know everything, know all instruments, know all materials and what they do, because we have to fill in the answer. There's no multiple choice. So I have to study for that. But man, after those exit interviews, my motivation is pretty low, pretty tired, but we're doing okay. And then after that, after this week, next week we start our DEX week. DEX week is basically a week of practicals. So we have a long list of treatments that we need to perform, and then we create a treatment plan for it. I think we have 4 days in sim, from 8 to 4 p.m. with lunch break, of course, of completing the treatment plan, which involves like doing crowns, doing fixed partial dentures, to doing veneers, composite, all that stuff. Basically like jammed into 1 week. You have to be very efficient. You have to make sure to not make mistakes, because basically each project they will grade. I think they don't tell us if we fail or pass that project. I think we find out. Luckily we don't have to study too much for it. You just have to like mentally prepare. It's just gonna be an exhausting week because like we are going to be doing those projects nonstop, and there's no talking allowed in sim, which is crazy because usually there's a bunch of talking in sim. It's gonna be very quiet, very tiring, but we'll get through it. They're just testing all of our hand skills, making sure we're ready to do it on patients, which is crazy. So that's why this is our last official week in sim. So we usually have sim every Tuesday and Thursday, but since we're getting tested next week, these are my last Tuesday and Thursday doing sim projects. Crazy. During sim right now, we are basically practicing for next week. We have to do all the same treatments, but we can get more feedback. We can mess up and then restart with new teeth. But during DEX week, there is no restarting, which is kind of scary, but that's okay. But we're slowly making through it. I just have to keep studying and studying and studying. I think I am going to go to a cafe. So now it's time to focus because I have a test on Wednesday. It's a lot on oral pathology, which is kind of fun, but also it's a lot of things that like look really similar. So you have to like make sure you have it differentiated in your head and like memorize those things. Okay, I have to get stuff done. Oh.
Ready? Oh, it's working. I'm not doing that. The song's so good.
Good morning. It's now Tuesday. It's 6:24 a.m. I woke up around 5:30. I have a test tomorrow at 7 a.m. So I'm studying a little bit in the morning before I go to school. Today we have sim literally all day. Usually on sim days we have 2 hours of lecture before, but now since we're practicing for our next week, we are going to be in sim all day practicing. Yeah, what I'm studying. I made matcha. Can you see it? Yep, studying oral pathology.
She's a double co-pilot, that's why. Say hi to your fans. Hi, fans. Thank you for the support. Super let it set. Yeah, like I take it out after 2 minutes, but then if you take it out too early, it's going to warp. And then everything like breaks on. Yeah. It's been a long day at school. It's currently Wednesday, and I had a test at 7 a.m. It was a lot on oral pathology. After that, I had 3 lectures, but we skipped some lectures to study. Me, Jasmine, and Ziza, as you saw, we were studying for our OSCE. That's on Friday in 2 days. It's in the afternoon on Friday. So we've been studying together because since we've been studying for so many tests, the motivation has been really low. But studying together helps because we can talk through things together and test each other, bring up certain things, and the way we say things, we help each other remember. So that's what we did. We had a room in the library, and talk things out. We skipped a couple afternoon lectures, and then the last lecture of the day was just a Q&A about our Dex week. That's next week, where we take all the practicals. So we went over that. After that, I went to the gym. But it just feels like such a long day because studied all last night and then woke up early to take the test and then was at school all day. But now I can relax a little bit. I think I will study a little bit, but not a ton. Tomorrow is our very last day in sim, which is so sad. Oh, it's not our very last day. It's just our last day doing like normal projects in sim because next week is our last week drilling in plastic week as a D2. We're going to be doing our practicals, and then after that we'll be done. We'll just have 1 week left of school, and the last week will be cleaning up the sim clinic, getting all our stuff, which is actually so crazy now that I'm saying it out loud. But yeah, tomorrow's the last day where everyone's going to be in sim doing projects where we can chat and do projects. In the beginning, I did not like going to sim so much, especially D1 year. We went to sim on Mondays, and it was hard because like I barely knew how to drill. We only went once a week, so I didn't get like a ton of practice in. So D1, we started the week every Monday with sim day. And then during D2, we'd go every Tuesday and Thursday. I like starting the week off with just lectures and then going to sim clinic the second day of the week. It was really tiring though because we upped the amount of projects that we do in a day, and then it was super fast paced. But slowly get used to it, and then you have all your friends that like sit near you. Now we're going to be all going to clinic soon. In clinic, we each are in different suites. So a lot of us are going to be separating, and we won't see each other that much, which is crazy. But yeah, I'm just rambling. The test went well today. Nothing, I mean, actually, yeah, it went well. I think it went fine. It was probably one of our harder ones just because there were so many different like diseases and symptoms we had to memorize. But I think it went just fine. Not a perfect score, but good enough to me. But yeah, relax the rest of the day and then prep for the last day of sim tomorrow.
You're in here quite early.
Are you recording? I bought lunch today. Chicken with a bunch of stuff.
All the colors of the rainbow.
Sadness. Happiness.
We finished our last day of sim. It's over. But we have a whole week of practicals. But
4 days. 4 days of practice.
the normal sim days is over.
Yeah. We need to come back and clean up, I think, right? 2 weeks?
Yeah.
2 weeks to clean up.
I'll probably vlog that week too, our last week.
Yeah, because we gotta take photos. We didn't even take any photos. Everyone left.
Yeah, we took it first thing in the morning.
Everyone freaking
Because
left.
everyone left like in 30
right
minutes.
away. Yeah. I was like, okay.
Yeah, we got us sim early, but we're probably one of the last ones still.
It's kind of
That's
sad.
Yeah, it is sad.
It's okay. It's gonna be okay.
I just got out of school and I just took my OSCE exam, and it was actually pretty hard. There's some questions where it was pretty hard and then some were pretty easy. There's like 7 different sections and you have to pass each section. So hopefully I passed each one. The hardest one we found was probably radiology, just because they asked some tricky questions, even though we know how to take radiographs. But the questions were just a bit tricky. But finally that's over. I didn't film that much today. I just went to school and then we had 4 hours of lecture in the morning and we were just studying for our exam. It was like a 75-minute exam. Kind of fast paced because you only had a minute per question and you can't look back at your questions. So that's why it was a little nerve-wracking. But we made it through. We'll find out our results later. But this is the end of the week. Yesterday was our last day of sim, which is kind of crazy. When sim ends, it's kind of weird because we all have a certain amount of projects to do. But since it's the last projects, we all finish at different times of the day. Some of us finish early, some of us finish later. So people are trickling out. Like, we started school at 8, some people were leaving at 9, 10, 11, and I stayed until lunch at least. But it's not like we can all like say goodbye at the same time. Also, we'll be in sim next week taking our tests, but there's just no talking. But yesterday was our last day of being in sim, where we can chat and do our projects together, which is kind of sad but also crazy. We'll be going to clinic soon and doing it on real people. But thanks for watching me in my week. Now I get to relax a little bit. We have decks all next week, so just focusing on my hand skills, but less studying, which is kind of nice. But thanks for watching. I hope you enjoyed. See you later. Bye.
Bloopers. Blah.
Your laptop can't even handle it. It keeps.